FAJIM Medicare Foundation organized a special medical outreach event in honor of World Hypertension Day on May 17, 2024, in the University of Lagos Central Mosque.
Because hypertension, they have hypertension, they will not treat it, and then damage their kidney.
A distinguished senior lecturer from the College of Medicine, UNILAG, was invited to share insight on hypertension.
And a chronic disease. In United States of America, they say it's about 80% of their adult population are hypertensive. In Nigeria, 25 to 30% of all of us adults are hypertensive. And it has been said that 1 in every 4 male individuals will likely be hypertensive in their lifetime. 1 in every 4. 1 in every 4 male individuals will likely to be hypertensive in their lifetime. And for female, 1 in every 5 female. Now, if we say 30%, or let me say 25%, if we are 100 people here, adults, the likelihood that 25 of us are hypertensive is there. It is that common. But hypertension being what it is not a disease that brings signs and symptoms.
Attendees were able to access complimentary medical services courtesy of the foundation. After conducting comprehensive checks and tests, the medical personnel provided medications to individuals with high blood pressure. In an interview with Professor Fatima Abdulkarim, the founder of the organization, she emphasized that the outreach aimed to raise awareness about hypertension, highlighting it as a silent killer disease.
Today is World Hypertension Day and is used to commemorate and raise awareness about the killer disease or silent killer disease, hypertension. Hypertension happens to be one of those diseases that is very common in this part of the world, and it is very dangerous because at the time that a patient develops the disease, it doesn't really manifest. The patient may not feel anything, may not feel they will feel okay all of the time, and the BP will be rising. Many people who come down with stroke and become paralyzed might not have been aware that they were hypertensive.
Mr. Adeoye Yekin Ademola, the treasurer of the UNILAG Muslim community, encouraged everyone to prioritize regular checkups for better health awareness.
My advice is that we should try as much as possible to place our heads on priority. Even now, there's another lesson that I learned about stress management. Before, when I came here, when I explained, when I was first tested, my BP, was high. Then they asked me some questions related to it concerning overstress of the system. And with this, I've been exposed that resting is an integral part of good health. I will advise people to come out en mass, to come and examine their body system.
They must have been picked up at one time or the other, maybe counseled and referred to the hospital. They must have been given drugs, but either because they cannot afford the drugs or because they are ignorant that hypertension is a disease that you continue to treat till death do us part. They feel that once the BP is normal, they don't have to take their drugs again. So they stop taking their drugs, they stop seeing doctors, and then gradually the BP rises again until it strikes and the worst happens.
It is essential to stay proactive about our well-being before it is too late.